brain and spine surgeon, and I specialize in minimal invasive approaches to the brain and spine. Today I'm here to talk about an interesting topic. The topic would be about safety and spine surgery. So when we talk about spine surgery, the common notion that exists is spine surgery is morbid. Any patient who undergoes spine surgery would be bedridden for a long time. Then there is that nosy auntie who talk about that spine surgery which went wrong with her relative and she's been bedridden for a lifetime. So there are so many such anecdotes which we'll keep hearing the moment spine surgery is mentioned. But the fact is something else. In today's age and time, the approach to spine surgery has changed. In fact, most of the spine surgery has almost become like a short stay surgery where we operate on the patient and within a day or so they are up and about. They are mobilized, they are made to walk, and within a day or so they are discharged. So usually the stay in the hospital is extremely small, and the pain that is associated with that because of the approach that is followed, which is usually minimal invasive, pain is also significantly reduced. So the patient himself wants to again be mobilized and is not too worried about the pain. So before we go ahead with spine surgery, it is important to understand what is the role of the spine in the human body. So what it does is provide stability to the entire body so we can assume an erect posture. That's one. It helps in maintaining our stability and posture. That's one thing. Apart from that, it provides the highway for the neural structure from the brain to come down and pass through different structures in the body. So any problem that is associated with the spine would largely involve these two parameters. One would be the stability of the spine and the second would be the space which is available inside the spine. So largely most of the spine surgery revolves around either creating space inside the spine or maintaining the stability of the spine. So based on the understanding of the function of the spine, we can go on to the next topic, that is spine surgery itself. So when we talk about spine surgery, so the aim is very clear. So there are two things which we have to establish. So in patients in whom the space inside the spine is reduced, we have to increase the space and provide the extra space that is needed, or reinstate the previous space which was already there, which has been taken over by spinal degeneration or because of the presence of a tumor or because of an accident or trauma to the spine. So we have to reinstate that, plus try and maintain the stability of the spine so that the patient can continue to assume that erect posture without much pain or discomfort. So the two main things would be again maintaining the stability, and second would be creating space. So when we do this, there are a few things which we have to remember. When we try to achieve spinal stability and decompression, there are a few things which we try and remember. So we try and do nowadays everything through minimal invasive approach. So the muscle dissection which we do to reach the space is much less. So the post-operative pain because of the very little muscle dissection would be very less. That's one. Second is, since the bony removal and all is very less in a minimal invasive approach, the possibility of instability in the future is also low. And thirdly, in patients in whom we see or anticipate an instability, we try and fix the spine in the first place. So this would form the crux of spine surgery. Apart from that, it's equally important to prevent neurological complications in terms of injury to the spinal cord, the roots, to the dura mater, which would lead to CSF leak. So these are things which again we have to avoid. So what all are the techniques that are available to reduce these things would form the next part of the talk. When we talk about safe spine surgery, there are three main aspects about surgery. One would be pre-op investigations, second would be the intra-op procedure that we try and do, and third would be the post-operative care that we can talk about. So when we talk about the pre-op investigation, yes, nowadays we can visualize the pathology in a much better way because we have very good MRI scans, we have CT scans, excellent digital X-rays. So all these things are able to give us an excellent idea about the pre-operative status. So we know exactly, we're able to pinpoint exactly where the problem lies in the patient. So we can accurately go to that particular point and try and solve a problem. Along with that pre-operative preoperatively we can do ancillary tests like electromyography, nerve conduction velocity. So these studies again help us in pinpointing the specific nerve which could be involved in the pathology, which would require decompression or which would need to be taken care of. So with the advent of good investigations, that aspect, the preoperative aspect, has been taken care of. The errors on that part has been reduced so significantly because of that. Second would be when it comes to intraoperative procedure. First thing that we always think of is confirmation of the patient identity, the side of the lesion, the level of the lesion. So this is always done when we do a pre-op check just before the patient is taken up in the operation theatre. Once the basics in the intraoperative identification of the side and the patient is done and the patient is taken into the OT, there are a few very important things which are done which will help in improving the safety. So one would be the technology that has come into the OR. So when we talk about technology, we operate most of the spine case under magnification with a microscope or with an endoscope. So what we see is magnified that much more. There is light inside the area where we are operating, so there would be the visualization is improved so much. So the basic fundamental is, if I can see something very well, the possibility of me damaging that is extremely low, almost to the extent of being zero. So if I can see something and recognize it, then obviously I wouldn't be damaging it. So that is the most crucial aspect of safety which has come to the fore. So we are able to not damage the dura, not damage it, because we can see it so much better with excellent visualization because of microscopes, because of endoscopes. Apart from that, we also have neuromonitoring. Neuromonitoring can be done, this is especially useful when we're dealing with spinal cord tumors. So the nerve which is below the level of the lesion is continuously monitored. So any damage to the spinal cord or the roots is picked up very quickly, and we can prevent further damage when it is picked up. Apart from that, we have extremely high-tech instruments like neuronavigation, which tells us exactly where we are is inside the spine. So the neuronavigation in simple terms would be GPS for the human body. So it largely involves the brain and the spine over here. So neuronavigation would help us navigate through these very complex structures with ease, with the knowledge of exactly where we are. Apart from that, the latest addition in the armamentarium of the spine surgeon and in our field is robotics. So when it comes to robotics, it has made the placement of transpedicular screws, which is extremely important in terms of maintaining stability of the spine wherever it is indicated, very safe. So you have a few new technology which has come in, which has made spine surgery that much more safer. Apart from that, one of the most important things that has come to the fore would be excellent neuroanesthesia techniques, where the anesthetists are able to anesthetize the patient, render him unconscious, and get him out very safely. The drugs that are available, the techniques that are used by the anesthetist are extremely safe, and this prevents so many morbidities and so many problems associated with spine surgery. So what has this advent of the new technology done to spine surgery? What it has done is it has made it extremely safe. Because we are able to see the structures more clearly, because we are able to identify the structures that we have to deal with preoperatively, the level that we have to deal with preoperatively very well, what we anticipate to see when we go inside very clearly because of preoperative investigations very clearly, and the presence of a microscope or an endoscope, which makes it possible for us to see deep structures very clearly, is that we have been able to reduce the access point very small incisions. So how is that possible? That's precisely because we know the exact level. So it need not be a huge incision and then again look for it in the dark. So we know exactly where we want to go, and then we place the incision exactly on top of it, and then we are able to directly access that structure without damaging any other structure above and below it. If you realize, in good old days, the main pain would not be from the basic pathology. It would be from going above and going below and dissecting a lot of muscles which are now unnecessary. So we can go exactly the site where we need to deal with the pathology and then come out safely. Assessment and the post and the intraoperative techniques and technology that we are able to use in every patient that helps us in making spine surgery safe. Then apart from that, there is a very important thing which comes post-operatively. So what we have in terms of post-operative care would be excellent physiotherapy, early mobilization. Early mobilization helps in preventing so much morbidity. So once a patient is up and about, is moving on his own feet, so many other morbidity which is usually associated with chronic bedridden status is taken care of. Now when we look at the whole picture, you must have understood why and how spine surgery has become safe. In patients in whom the problem can be dealt with surgery, I can easily suggest that it should be it is something which has to be accepted and which can be easily embraced in a very good way, and you will be able to take care of your pain. So as I've suggested in the talk, spine surgery has now become safe. The reasons for this would be good care, the advent of new technology, the ability of surgeons to adapt to that new technology and offer it to our patients, and most importantly the minimal invasive approaches which delivers precise surgery, to the point surgery, making it possible for patients to be mobilized or to be up and about on his feet, to help him get back to his normal life in very quick time. So if you ask me, spine surgery has changed and has changed for the better. And if there is a patient who requires spine surgery, I think the fear element should not be the reason why he shouldn't be going ahead with a surgery which is indicated. Thank you.